Hi everyone, this is Justin Vaughn. I'm with Med Global Services, and today we want to bring you an article entitled Under Duress, CMS Prepares to Hit Hospitals. Let's begin. The power of the purse and the power to prosecute are two of the tools governments have at their disposal to effect change in both individuals and institutions. There's nothing like a good old-fashioned threat by federal authorities to cause citizens to sit up and take notice. But when such threats are issued to America's frontline responders in the midst of a national pandemic, more than a little consternation is bound to result. That's the situation hospital executives find themselves facing this week as they are about to become potential targets of punitive government action. This section is entitled, Raising the Alarm. National Public Radio, or NPR, is reporting that it has come into possession of, quote, internal documents, end quote, drafted by individuals at the Centers for Medicare and Medicaid Services, or CMS, which indicate that the agency, quote, is preparing to crack down aggressively on hospitals, end quote. The impending action will specifically be against those facilities who failed to report, quote, complete COVID-19 data daily into a federal data system, end quote, as mandated earlier this summer by the Trump administration. You will recall that the U.S. Department of Health and Human Services, or HHS, back in July, set new parameters for reporting COVID information to government. Instead of hospitals providing their virus-related statistics to the Centers for Disease Control and Prevention, or CDC, they were now directed to report their COVID data, for example, number of COVID patients, availability of intensive care beds, etc., directly to HHS via a newly created reporting system. The move caused concern in some circles that COVID information was being taken out of the hands of the epidemiology experts and redirected to partisan operatives with political agendas. What many fail to realize is that the CDC, like CMS, is an agency within HHS, and there was never any plan to limit the CDC from accessing the data. On July 16, ABC News reported the following. Quote, CDC Director Dr. Robert Redfield forcefully defended the change in a call with reporters, insisting that the federal government's effort to create a single database run by HHS linked an estimated 4 billion disparate data elements on everything from testing to the race and ethnicity of patients to hospital supplies and bed space, instead of through the CDC, can only help the CDC's efforts, end quote. This section is entitled, Lowering the Hammer. In late August, CMS issued a rule indicating that failure to comply with the new reporting methodology could cause hospitals to forego their federal Medicare funding. The rule went into effect August 25 without any chance for comment or revision. The agency reasoned that the public health emergency was sufficient cause enough to dispense with the normal bureaucratic processes. The government now appears ready to make good on its late August threat. The draft letter from CMS requires hospitals to report data, quote, for all 7 days, including weekends, end quote, into the HHS data collection system. According to the NPR report, failure to comply after multiple warnings, quote, will result in a termination of the Medicare provider agreement, end quote. The new guidance, which may be sent out to hospitals this week, will also add new reporting requirements according to NPR. For example, hospitals will have to provide daily numbers relating to influenza cases, not just COVID-19 cases. Hospitals that fail to follow the new regulations could be ousted from both the Medicare and Medicaid programs. CMS estimates, by the way, that 6,200 hospitals currently participate in those two federal health programs. Many have expressed their concern over this planned move, describing it as overreaching and a nuclear option. However, a CMS spokesman said the move was necessary as the voluntary reporting system provided data from only 85% of the nation's hospitals. Ironically, only, quote, 24% of America's hospitals met the HHS reporting requirements for the week of September 14, end quote, according to an internal CDC report obtained by NPR. The drop in participation may have been due to more difficult and time-consuming data gathering required by the July mandate. This final section is entitled, Preparing a Response. According to one source, some hospitals may not be required to report directly to the HHS data system if they are in a state that gathers the data and has worked out a deal with CMS that allows the state to do the reporting itself. It is also important to note that many hospitals are already following the government's guidelines on this issue. But for those facilities that currently fall into neither of these two camps, they will need to make immediate preparations to comply with the new reporting mandates or risk significant loss of revenue. We will continue to update you and to keep an eye on this issue, providing you with new information that may prove helpful. If we can assist you in any other way, please let us know. Our business solutions can be found at www.miramedgs.com, and you can reach out to us at info@miramedgs.com. Thank you.